Hello, and thank you to everyone for being here and for including me in this fantastic conference. My name is Maya Newman, and I am a pediatric and adult physical medicine and rehabilitation assistant professor at the University of California, Los Angeles. And I'm here representing the medical specialty of physical medicine and rehabilitation, or physiatry. And I want to thank my wonderful review team, and specifically Kelly Kakome, for helping me put this slide deck together. Today, I'm going to review the findings of our scoping review on climate change through the lens of physiatry. We are all here because we understand that climate change affects all life on Earth in critical and unprecedented ways. Those with the lived experience of disability make up 1 billion people on Earth, and they're disproportionately affected. PM&R is a medical specialty that treats a range of people, including athletes and people with the lived experience of a functional or sensory impairment. Our review seeks to answer two questions. What is the breadth of available studies at the intersection between climate change and PM&R? And what are the areas in need of further research to address developmental gaps in knowledge for the physiatric patient population? Our inclusion criteria was literature published between January 2008 and July 2023. We included tens of search terms related to 3 different categories: climate change, PM&R, and the various disorders that fit under the breadth of the PM&R patient population globally. We initially excluded non-primary studies, and through our review process, we ultimately also excluded articles related to pandemics, general weather, geophysical disasters, and any paper not specific to both PM&R and climate change. Okay, here's our PRISMA diagram. We use 5 scientific databases. We reviewed the Journal of Climate Change and Health, gray literature sources, and citations. And our whole search brought us to 1,913 articles, but only 38 met our inclusion criteria. So what did we learn? From a data perspective, we saw trends in the actual dates of publications, the types of journals, and the geographical coverage of the 38 articles that we included. Structurally, we then organized the 38 articles into 3 unique thematic categories. Theme 1, where we had 19 of our 38 articles, and they focused on climate change and health effects. Theme 2 was 14 of our 38 articles, and it focused on climate change and possible interventions. And then theme 3 was the last 4 articles, and it focused on climate change and other points of interest. So I'm going to jump into the data, and over the next 6 slides, I'm going to cover the trends and the themes. Okay, so you'll see in this line graph here, we included studies between 2008 and mid-July 2023. So the first finding showed an upward trend in the number of publications on climate change and PM&R. You'll see specifically from 2020 to 2022, there's a clear jump in the data. Because we only included half of 2023, and one of our included articles is in press, it appears that the trend slows, but it's too early to determine because we still had half the year to go. So nevertheless, we see that there's definitely been an upward trend in the amount of research in the area, and we find that this is a positive sign. Okay, our next finding is that the publications came from a variety of journals of all different types. So we had 10 disease-specific journals, 6 sports-related journals, 5 public and environmental health journals, 4 allied rehabilitation health professional journals, 2 environmental science journals, 1 general journal, and then surprisingly only 1 rehabilitation journal, and 0 from any PM&R specific societies. So overall, there was no lasting trend that we saw between these articles, and specific to the PM&R population. Okay. So this map shows the regions of the area from which the articles were published. The majority of the studies came from North America. And if you include Australia and the UK, 60% of the research came from English-speaking countries. Now, this may not come as a surprise because one of our inclusion criteria was that the articles had to be written in English. But interestingly enough, 21% of the articles came from Asia, and overall 40% of the articles came from non-English speaking countries. So let's move on now from the findings to the themes. Okay, so again, our first theme focused on climate change and health effects. Just going to highlight a few things here. The majority of the articles we included fell under this category. The two main climate change areas were environmental pollutants, with air pollution being the most common, and heat-related injuries. And the main health effect on PM&R patients was heat-induced injuries for athletes. Okay, so our second theme focused on climate change and possible interventions. The main climate category was natural disasters, and the main interventions were related to disaster preparedness or management, followed then by telemedicine. We also noted that in this theme, only about a third of the articles in this category were written by PM&R physicians. Okay, so the third and final category included the 4 articles that didn't fit under the previous 2 themes, but we did note that 2 of these articles were about provider perceptions of climate change. Okay, so what did we learn from all of this? In the past 15 years, only 38 articles met our inclusion criteria for the scoping review. More than half of the articles came from North America, so many regions around the world, including Africa, South America, and Oceania, are underrepresented. We only included articles written in English, so we're unlikely capturing the breadth of the international research. Additionally, none of the articles published came from official journals of PM&R societies or groups. Important notes, though. The American Academy of Physical Medicine and Rehabilitation put out a call for papers very recently for a special issue they plan to publish in winter 2024 on climate change and health. And the International Society of Physical Rehabilitation Medicine, or ISPRM, and the Association of Academic Physiatrists, or AAP, published 2 position papers recently that didn't meet our inclusion criteria, but they're important. I'm going to cover these in a moment. While there's lots of gaps in the research, fortunately, there is momentum, with an increase in the number of publications and also with PM&R organizations highlighting that we do have knowledge gaps in these position papers. Okay. So in the next 2 slides, I'm going to review the AAP and ISPRM position papers that help to identify the research gaps in PM&R. And these were also gaps that we identified when we were doing our scoping reviews. Okay, so first, the gaps identified in the AAP position paper. So just to highlight some, disaster preparedness for people with disabilities, investigating long-term and mental health consequences for people with disabilities, prevention of exertional heat illness, plant-based diets, green space accessibility, promoting active transportation and physical activity, technical innovations to combat power interruptions, and reusable and biodegradable medical equipment. ISPRM published a position paper outlining a strategy for action, which Mark Lee reviewed or referred to yesterday, using the acronym CLEAR: Collaboration and Communication, Climate Leadership, Education, Advocacy, and Research. So the idea is that physiatrists work in tandem with allied rehabilitation healthcare professionals, along with persons with the lived experience of disabilities. And after yesterday, I also would think that it's important that we include the perspective of Indigenous populations and the current experience of small island countries who are right now at the forefront of the climate crisis. See Clear goes through all these steps to take action at the micro, meso, and macro level. Okay. Finally, we have a lot to learn through collaboration. And the fact that we're all here collaborating, learning together, shows that we're absolutely headed in the right direction. PM&R has a lot to learn from other medical specialties, public health, advocacy fields, data analysts, epidemiologists, meteorologists, and many others. Okay, so to wrap this up, there's a paucity of research on climate and PM&R. We need to include people with disabilities when we develop our research protocols. We need more experimental perspective studies on climate change and patients of physiatry. PM&R specific journals need to include climate change in their aims. PM&R and allied healthcare professionals need to include climate change in their training programs. We need to collaborate with low and middle income countries, Indigenous groups, and all other fields that are represented here at this conference. Finally, we need to have more funding in climate change to motivate more people to do research in this area so that we can continue to expand on all the wonderful things that we're doing here today. So with that, I want to thank you all for being here, for your partnerships, and so that we can move forward together. And here's some references in my background.